Can I wear my rigid gas permeable contact lenses after ptosis correction and Asian upper eyelid blepharoplasty? Will wearing my rigid gas permeable RGP contact lenses make my ptosis recur after my eyelid ptosis correction? I am a middle-aged Asian woman who has been wearing RGP lenses for 30 years and developed ptosis.
Thank you for your question. You've submitted a question without a photo, but in the substance of your question, you're asking, is it all right for you to wear rigid gas permeable lenses after undergoing ptosis surgery? And you state that you've been wearing these lenses for 30 years, and naturally you developed ptosis and you're concerned about recurrence after wearing the lenses. Well, I can share with you what would be my counseling to patients in my practice who present similar situations like yourself. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Eyelid ptosis is a very common issue that we deal with in our practice, as well as Asian eyelid surgery, and of course the combination of Asian eyelid surgery with eyelid ptosis. So I can basically break down for you what are the variables that may have contributed to your ptosis. And to begin with, certainly it is a well-known association between the wearing of hard contact lenses and the causing of ptosis. The conceptual theory is that when the eyelid is blinking and the muscle called the levator muscle is rubbing against the contact lens, that muscle tendon called the levator aponeurosis can become thinner and result in some degree of ptosis. And there's been also association with other variables of different types of contact lenses, but essentially there is a known association. Now, you say that you've been wearing these lenses for 30 years and you're middle-aged. Well, there are also other causes of ptosis that are not uncommon at this stage of your life, and the term for that is called involutional ptosis. And so this is a situation where the muscle that lifts the eyelid, again the levator aponeurosis, can become thinned or stretched. So it's more of an age-related issue. So then the question, of course, is what do you do to try to maximize the longevity of your surgery? Well, that's a challenging question because you are dealing with clearly an important part of your visual function is to wear these contact lenses. A lot of times people who wear rigid gas permeable lenses like yourself are people who have significant astigmatism or conditions such as keratoconus, and basically their cornea needs a proper lens in order to be able to see very well. A lot of times if people don't need contact lenses or can wear glasses, well then they choose to wear glasses. But I would suspect that if you have the type of condition where the contact lens is necessary, well then you're just going to have to accept that a certain amount of wear and tear of your eyelid tissue moving forward may still transpire. And again, it's a matter of balance. So I think that, of course, this is a coordinated effort between your oculoplastic surgeon who performed your surgery and your ophthalmologist who might be able to offer you maybe softer lenses or other options in the field of ophthalmology, whether it's even whether you're a candidate possibly for laser vision correction or other alternatives. But the point is that yes, there is a risk of the foreign body or contact lens wearing down the eyelid tissue so that you may need to deal with the ptosis again. Certainly, it also is important for you to remember to use lubricating drops. that can hopefully help you with some of the frictional aspects of the interface between the eyelid and the contact lens. And of course, good ocular hygiene, proper contact lens hygiene, and other things that can at least minimize the amount of potential inflammation and irritation that can be associated with the wearing of contact lenses. And of course, as you get older, we also understand that the eyes get a little more dry. And that's another variable that has to be factored in. And as I said earlier, involutional ptosis, age-related thinning of the tissue, can still happen regardless of the presence of the contact lens. So it's not necessarily always a direct cause and effect, but there can be multiple variables contributing to the ptosis. So I hope that was helpful. I wish you the best of luck. Thank you for your question.